So, dear friends, first of all, I can tell you that it's very difficult to do a presentation after such a wonderful presentation. Once again, thank you. It was really very interesting and very helpful. So, first of all, I want to thank the Academy for the organizing this two-day conference, and personal thank to our president, Professor Miklos Kasla. Thank you once again. And for inviting and to give us opportunity to be part of your wonderful team. Now allow me to give very briefly my small presentation. So as you see, Georgia is not a very big country. We are 70,000 square meter, and we have 11 regions and 64 municipalities in Georgia. It's briefly information regarding Georgia. So, as you know, it's data from WHO that there were an estimated 20 million new cancer cases and 9.7 million deaths. The estimated number of people who were alive within 5 years following a cancer diagnosis were 53.5 million. About 1 in 5 people develop cancer in their lifetime, and approximately 1 in 9 men and 1 in 12 women die from cancer. On this slide, you can see the structure of mortality in Georgia. And as you see, cancer is on the second place after cardiovascular disease, like in many countries. So, now about Georgia. More than 90% of the population in Georgia have one or more non-communicable disease risk factors. Nearly 1/3 of the population is at risk of premature death due to non-communicable diseases. The risk of premature mortality from non-communicable diseases is more than double for men than in women. Now you see the case for investment in preventing and control of NCDC and non-communicable disease in Georgia. And you see that we put quite big money. And we hope that it will be very effective for our country. Sorry, it's the same. Now, the government responds to non-communicable disease challenge. To reduce the burden of NCDCs via multi-sectoral cooperation, reach the highest standards of the health and productivity of population at any age, to ensure that NCDs no longer represent a barrier to health and social economic development. And strategies: tobacco control, national strategy 2021-2025, strategy on physical activity, and strategies to reduce consumption of salt, sugar, and fat in Georgia. So now you see the classical triangle of tobacco control that we have the same in Georgia. Tobacco control in Georgia. We are very proud that we have Georgian European Union Association Agreement agenda. And you see, and we try to follow step by step all these recommendations. Now you see the tobacco control landscape in Georgia from 2003 till 2023. And really, it's not very easy, but we try to follow this agreement. But many times it's very difficult because sometimes it's needed to fight with big, very big commercial structures, and it's not so easy. The same strategy goals: promoting the health of the population of Georgia and reducing premature death from non-communicable diseases by decreasing the prevalence of tobacco use up to 15%, and second-hand tobacco smoke exposed to 5 by 2030. The signature and ratification of the protocol of eliminating straight tobacco products in one of the priority activities of the National Tobacco Control Strategy. On this slide, you can see all activities, tobacco control activities in Georgia, and all of our partner structures and foundations. On this slide, you can see the non-communicable diseases surveillance and main sources who are involved in this big activity. Now about cancer. The incidence of cancer in Georgia and WHO European region. And we have told that the incidence in Georgia is higher than in other part of the European region. How we collect the cancer data? I can tell you that I think that the most successful activity in field of oncology in Georgia was the activity after then we established cancer registry. And we have now cancer registry in Georgia. But in previous time, in old structure, we collected the data in different cancer centers in regions. Batumi, Kutaisi, Zugdidi, Tel Aviv, Gori. These are different parts of Georgia, in east and west part of Georgia. We sent at that time all this data to the National Oncology Center in Tbilisi, and after them, we send it to the Ministry of Health. Now, this state medicine is destroyed. All medicine is in Georgia private. I'm not happy, but it is a real fact. And now, the private units, it's obligatory for them directly send it to National Center of Disease Control, NCDC of Georgia. And these 230 private providers send it to directly to this national cancer data. We have a unified cancer information system that works quite good, that is split in 3 different parts. First of all, the screening module, the other one is cancer module, and the laboratory module. And as you see, in screening module collects all screening data, cancer module and registry collects all cancer data, incidence, treatment, and follow-up. And the last one, laboratory, collects all screenings and cancer data. As you know, we can prevent 1/3 of the most common cancer, staying lean, eating smart, and moving more. At the same time, we know that they are preventable cancers. 1/3 of breast cancer, we can prevent half of colorectal cancer and 2/3 of esophageal cancer. Now, cancer registry. As I mentioned, we have 213 providers of cancer care, and total number of cancer per year it's around 30,000, and number of new cancer cases in Georgia it's about 11,000. Aim of the cancer screening program in Georgia: to reduce mortality caused by breast, cervical, and colorectal cancer through early detection, to maximize early detection of cervical cancer in the target population, to ensure equitable access for the women to the cancer screening, to ensure that services are acceptable of appropriate to the needs of the eligible population, to achieve high standards of the program management, service delivery, monitoring, and evaluation of accountability. The same data quality, I can show you the Universal Health State Program, and finally all these data come to the cancer registry data. And I can tell you that we are happy with this new the Health State Program, because it works, and it works very good. Yes, of course, like in all countries, the financing is not enough. We ask more and more money to government. Sometimes they give us some money, sometimes they tell us that they will give some extra money next year. So now, the cancer main indicators in Georgia. Like in many countries, you can see that these data are similar to our neighbor countries. And as you see, the 5 main localizations in female is breast, thyroid. Yes, it's very interesting. I want tell you that we don't know why, but thyroid cancer in women population is very high in Georgia. Now we are active to find the reason why it's happened, but it was increasing as minimum 50 times for 3 years until this time. We can't understand what happens. And as my colleagues told me, in many countries they see the same. So breast, thyroid, colorectal, cervix, and ovarian. And 5 main location in male is prostate, lung, bladder, colorectal, and larynx. The same in under 50 years and between 50 90 in both sex. Now, geographical distribution of cases, cancer cases in Georgia. As I mentioned, we have 11 regions, and as you see, the highest data we have in Tbilisi, that is capital, and after them in rural area in different regions. According to the international estimates, the lifetime risk of developing cancer in the population of Georgia is around 40%. I think that it's very high. Georgians, we are not big country, and this 40%, it's too much for us, like too much for any country. Now about screening. This cancer screening state program was developed in Georgia in 2008. And it was, at first time, it was only municipal program for the population of Tbilisi, its capital of Georgia. And in 2011, it was replicated in all Georgia. And now, the same. We provide breast cancer screening, cervical cancer screening, colorectal cancer screening. We don't tell that we provide prostate cancer screening. We call it prostate cancer risk management, and thyroid cancer screening in between women's, as I told, because the incidence is very high. What about breast cancer? We provide mammography, physical examination, ultrasound, and biopsy. And yes, of course, we use double reading, independent from 2 radiologists. And we provided the target age group is 40-70. Many foreigner experts, we do it from 2008, from 40. They told us that it's luxury for Georgia to begin it from 40. But I can explain you why we do it from 40. In Georgia, in our experience, in age group from 40 till 45 or 50, if a lady is participate the state screening program, for her it's only one chance to receive mammography free of charge, because the insurance company not covers this kind of investigation. At the same time, when we analyzed our results, anything around 20% of all cancer cases are in age group 40-50. It means that if we begin from 50, we lose these 20% of cancer cases. And I can tell you that we are not very happy with this, but the state screening program, cancer screening program in Georgia is split in 2 parts. For Tbilisi, and that is managed by City Hall, and the other one for regions, that is managed by NCDC. We explained them last maybe 6-7 years that they have it don't to be split because the money are the same, it comes from state budget, and the management have to be same. Like extra financing, they tell us that they will do it from next year. We are waiting. So what about cervical cancer screening? Till this time, I want to tell you, till this time we provide opportunistic screening. From 2023, it is on slide, but to be honest, we try to do first steps to move to the organized screening, but it's not so easy for us for many reasons. We provide pap test. It's also, I want to tell you that it's cytology based, but in I'm sure that in as maximum 3 months, we move to the HPV testing. Also, it means that for target group from 25 till 30, it will be the same cytology based. From 30 till 60, we decided to move to HPV testing. Colorectal cancer screening, the target age group is 50-70. We provided 2 years, once in 2 years. As you see, the same. Here you see it's operated by NCDC and City Hall. And the test, we provide IFOB test. If it's positive, we provide total colonoscopy with biopsy. Yeah, at the same time, last 2 years, the state program covers anesthesia if it's needed. If patient want to do colonoscopy by anesthesia, it's covered from state program. And it covered polypectomy or biopsy with histology. So we provide prostate cancer risk management. As I told you, we check the prostate-specific antigen, and if it's positive, we send the patient to the to urologists. And I can tell you that we find many cancer early stage, prostate cancer early stage, and it means that we have official letter from National Urological Institute of Georgia that after when we began this prostate cancer screening risk management, the number of total prostatectomy by laparoscopic surgery was increasing 200 times. It means that they found many cases, early cases, because to do laparoscopic prostatectomy in cancer, in case of prostate cancer, it's only possible if it's very early stage. So, and thyroid cancer risk management. In women population 25-70, we provide ultrasound, endocrinologist consultation, TSH, and biopsy. So screening program management and information exchange, as I mentioned, we have two. It's managed by two structures. It's NCDC for regions and then City Hall. And finally, they come to the one register. Yeah, you see it here. The same unified cancer information system that brings together screening information and cancer data information. And the owner of this system is National Center of Disease Control in Georgia. This same, we have very good electronic services that works really very good. Now, cancer screening providers. We have many screening providers in Tbilisi and in regions, but at the same time, I will explain you in next slide which kind of big problem we have now. It's screening program improvement process, and you see that we try our best to increase the coverage, because coverage is very low, and now I will show. Yeah, we try to organize booking system to involve general practitioners and pay them some extra money for each case. It begins to work, but it's not so effective like we want to see. Now you see that screening coverage of state program is very low. There are two main reasons when we analyze. The first of them is that, as I mentioned, in Georgia, maybe really 100% of all medical units are private. At the same time, the prices in state cancer screening program are very low. And these medical units don't have any motivation to come as a participant in this program, because for the same procedure, for example, a very easy example, for mammography, for one lady, for mammography, the government pay us in dollar, it's 12 euros for each case. In private unit, for each lady, for each site, they ask you 60 euros. It means that they don't have any motivation to come to jump in this program. The same, the coverage, yes, of course, in Tbilisi, in capital, it's much higher than is in regions, but in general, it's very low. And as we know, if we are waiting, if we are waiting for effectiveness of screening program, the minimal coverage patterns have to be 60% or more. In our case, it's very low. And now, the screening, promotion, and communication, here you see everything that we do and what we want to do. The same. What we want to have, we have a very good the National the National Center of Disease Control every year organize a awareness campaign for all Georgia to increase the coverage, but to be honest, yes, it works, but they need more money. It's only 25,000 euros for all Georgia. It's not enough because it's very expensive to come on TV shows and to speak. As you know, it's all countries. It's very expensive. The same what we want to do to increase screening coverage. And once again, in today's world, networking is vital for better cancer care in all countries. And on behalf of young Georgian oncologists, I want to express my high gratitude to the Central Eastern European Academy of Oncology for continued efforts, enthusiasm, and comments. By providing an inclusive forum for dedicated professionals to collaborate in cancer care, engaging in knowledge sharing, and monitoring the next generation of oncologists. The Academy is unique positioned to play an important role in Central Eastern European and partner countries like Georgia. Thank you.